Welcome to Enroute Pharma. Last class, I discussed about what is drug and dosage forms and how the dosage form will convert in the form depending upon the route of administration and physical form. Alright. So why we need these dosage forms? First point, see the drug must be in a safe, convenient delivery, right? The drug must be safe, convenient delivery of accurate doses. Okay, of accurate doses. And the examples of this is, tablets is one of the example. See, the drug is converted in the form of dosage form, right? The dosage form is nothing but what? Formulation. Okay. So this formulation we're going to give in the form of what ma? We're going to convert this dosage form depending upon what ma? Route of administration, right? So why we need dosage forms means to provide safe, convenient delivery. Example tablets, capsules, and syrups. And the drugs which are absorbed by the moisture or atmospheric oxygen or atmospheric oxygen. So then we can convert in the form of what ma? Coated capsules or sealed ampoules. And next, to protect the drug substance from the gastric acid after oral administration. Okay, so what ma? To protect drug, okay, substance or drug substances from GIT tract, okay, or gastric acid. Okay, after what? After oral administration. For example, we will convert in the form of what ma? Entry-coated tablets. Entry-coated tablets are nothing but what? The drug that absorbed in the intestine. Okay, that we will call as what ma? Entry-coated tablets. And you can think the need, why we need into those forms. See, to mask the bitter taste and odor of the drug substance, or conceal or mask the bitter taste or odor of the what ma? Drug substances. Okay, and if you take a liquid preparations, see, any drug we can convert in the form of liquid preparations, we can convert in the form of what? Semisolids, or we can convert in the form of solid forms. So here, to provide the liquid preparations of drug which is insoluble or unstable in the desired vehicle, then we can convert in the form of what? Suspensions. Means liquid preparations of drugs, okay, that are what ma? Insoluble or unstable. When it is insoluble or unstable in the desired, in their vehicle is nothing but what? I had already told you, vehicle is in liquidous forms. The excipients will called as vehicles. So then we'll convert in the form of, for example, we'll convert in the form of suspensions. Okay. Next, the drugs which are desirable. These are what? Insoluble and unstable. When they have desirable vehicle, then we'll convert in the form of what ma? Solutions. Okay. So if you take the drugs, when you apply on a topical administration, that means it must enter into the skin, right? So then we'll convert in the form of what? Ointments, creams, gels. Okay, so that is what? A nasal preparations or whatever it may be, the drug action from the topical administration site. And next, the drugs the drugs that insert into the body. Insert into the body. Okay. Means insert into the body cavities or insert into the body orifices. Okay. Then the example is rectal vaginal suppositories. Okay. The suppositories is nothing but what? They are semi-solid. When it enters into the body, because of body temperature, it will melts and shows the therapeutic activity. Okay. So that we need what my dosage forms. And next, think the drugs which can place on the what body tissues or which can drug enter into the body tissues. Nothing more what we're keeping a patches or take a bandage. Okay, transdermal patches or we'll call it bandages. That means what ma placement of drug into the placement of drug within the body tissue. Placement of drug within the body tissue. Next, the last thing, there is another therapy or another this one what the drug that shows action on inhalation means something what nasal sprays or the meter dose inhalers or dry powders which you're going to take what ma by nasal. That's called as what ma the drug that shows the activity through inhalation. Through inhalation therapy. That means inhalants. Okay, so these all are the points we have to discuss. You have to know why the drug will convert in the form of atma, particularly the dosage form. Okay, the dosage form may be what? The dosage form may be a solid, liquid, gaseous, or semi-solid. Okay, solid, liquid, semi-solid, or gaseous form. Okay, these are what? The physical forms. Understand ma? So next, I'm telling about what ma last class I already told you about the classification of dosage forms. That is depending upon what ma route of administration and depending upon the physical form. Okay, the physical form is solid form, solid dosage form, liquid dosage form, semi-solid dosage form, and gaseous form. Whereas route of administration, what? How the based upon route of administration? See the based upon the route of administration. Okay. Based upon the route of administration. Okay, based upon route of administration, it was oral route, parenteral, topical, transdermal. I already told you respiratory. Okay, respiratory because very important for respiratory infections. Okay, COVID is done by what? COVID coronavirus. What we got? That is by the respiratory infections. Okay, so inhaled or respiratory. Next, which route of administration we can go? We can go for ophthalmic. Means giving a drug to the eye. Okay, and rectal, vaginal. Okay, so the route of administration is oral. Parenteral is nothing but what? Injections. Okay, and topical, ointments, creams. Transdermal, that is the drug that is on the body tissues or implants or patches. Respiratory or inhalation, that is metadose inhalers, dry powder inhalers, that is nothing but what ma? You know, for asthma patients, most probably what they'll go for what? MDIs, metadose inhalers. Okay, that's what inhalers. Ophthalmic, that is giving a drug to the eye ointments, okay, eye drops, okay, and rectal, okay, for antiseptic purpose, we're going to give the suppositories in the rectal, okay, and vaginal also, okay. So these are nothing but what route of administration. I had already told you physical form, right? Physical forms are solid dosage form, liquid dosage form, semi-solid dosage form, and gaseous dosage form. So, based upon the oral route, what you will take? See, this oral we are going to take what? Internally. Okay. So, internal route orally will take what ma? Tablets you will take, capsules you will take, syrups you will take, suspensions you will take orally, emulsions, etc. And also you can take what ma? Dry powder inhalers, pressured mid-dose inhalers, nebulizers, nebulizers. Normally infants or the age of below 5 years, they'll go for what ma? Nebulization, right? Okay, if they're having any respiratory problem or upper respiratory infections, they'll go for what ma? Nebulization or vaporizers. Okay, this is what by taking orally. In the orally only, these all are what you're taking. But in oral, there is a what? Sublingual tablets and there is a buccal tablets. Means the drug shows the faster activity. Means suppose, if you're having the cough, then you'll take Strepsils now. That's nothing but what ma? Lozenges. Oral disintegrated tablets, fast dissolving tablets, chewable tablets, mouth washes, toothpaste, ointment, and oral sprays. That is, comes in what ma? In the tablets only, in the oral only, what ma? There is a sublingual and there is a buccal. Okay. There is sublingual, there is a buccal, and also there is a what ma? There is a enema, what ointment, suppositories, that time what ma? They all comes in what ma? Internal route, whereas parental route. So parental route giving what my injections or infusions. So injections, how many injections you have? IV intravenous, IM intramuscular, IC intracardiac, and intraperitoneal, intracerebral, giving the injection to the brain, right? Cerebral, intracerebral, and intradermal, and also will give what ma? Subcutaneous, intravascular, intravenous, intramuscular, intracardiac, intraperitoneal, intracerebral, intradermal, and subcutaneous. Whereas come to topical route, means giving the drug to the topical, means to the dermal or to the mucosal or to the what? Percutaneous. Suppose in this topical only, they have, see in this topical only, what we have? We have dermal, we have mucosal, we have percutaneous. What is dermal? Giving on the skin, topical application. Okay, that is to the mucus, right? Mucus member, mucosal. So here, dermal, right? So dermal, what we have ma? Ointments, liniments, and nothing but what ma? Liniments will apply for the joint pains, okay, for what any arthritis, right? Orthoarthritis. So that will go for what ma? Liniments, pastes, creams, lotions, lip balms, medicated shampoos, okay, and dermal patches. So these are what ma? For topical, right? For mucosal, see, for mucosal, mucous membrane, right? Where ear drops, eye drops, nasal sprays, ointments also will go apply for mucosal, hydrogels, gels. And also there is a suspensions that is called as a very minute suspension, nanosphere suspensions. Nanosphere suspensions. My writing is not good, but try to understand, please. And what microsphere tablets also we can give for mucosa. Next one, percutaneous. There is nothing but what, simply the transdermal patches. Okay, so this is for what, ma? This is for topical. Understand, ma? This is for, these all are for what? For oral. In this oral only, they will going for what, ma? Internal. Okay, in this internal only there is a sublingual and there is a buccal tablets also. Whereas parenteral, what, IV, IM, intravenous, intramuscular, intracardiac, okay, intraperitoneal, subcutaneous, okay, intracerebral and intradermal, right? And whereas here the dermal, in the topical, what, there is a dermal, mucosal, percutaneous. Okay, understand until here? These are all what, based upon what, route of administration. These are based upon route of administration. Okay, so next what, based upon physical form. So the physical form, I already told you route of administration based upon physical form. Okay, there is what, first one, solid dosage form, right? So normally solid dosage form, they having particular shape, they having particular size, right? So depending upon they are shaped and unshaped. They are divided into, solid dosage forms are divided into, see, by physical touch we can tell which shape it is, right? And whether it's hard or not we can tell. That's called as what, ma? Solid dosage forms. In the solid dosage forms, they are shaped and unshaped. What is the shaped and unshaped? Shaped is tablets, is capsules, okay, transdermal patches. Transdermal patches. So tablets is having a what, concave shape, cylindrical shape, biconcave shape, okay, and capsules, they are having what, ma? Different. The capsules are, is, I'll tell you, but capsules are, they are having what, ma? Hard gelatin capsules, soft gelatin capsules. Normally they are in form of oval shape, okay. Unshaped, nothing but what, powders, okay, for external use and internal use. External use and internal use. Okay, these are for what, solid. Whereas coming to the semi-solid, you already know, you can identify semi-solid. There is again shaped and unshaped. Okay, so what is shaped? Suppose if you take a semi-solid, that is what, suppositories, or we'll call as, if you go for vaginal suppository, we'll call as passaries. If you go for rectal administration, we'll call as suppositories. Okay, suppositories. That is for what, ma? For rectal administration. If you go for passaries, that is for vaginal suppositories. This is for what, shape. They're having a particular shape, right? They have bullet shape, okay, they are cone shaped, right? Whereas unshaped, gels, creams, ointments and pastes. Okay, so here the solid dosage forms is shaped, unshaped, tablet, capsules and tablets, capsules and transdermal patches, whereas unshaped, powders for external and internal use. For semi-solid, they are suppositories and what, ma? Passaries for vaginal and suppositories for rectal. Okay, whereas unshaped, gels, creams, ointments and pastes. There is another physical form. That is what? Next physical form is liquid. Next physical form is liquid dosage forms. So liquid dosage forms, okay, liquid dosage forms is mainly there are three types. Normally two types, we'll call as two types. That is monophasic and biphasic. So what is mono? A single phase. Okay. So it can be soluble in the what? In the liquids. Okay. It can soluble in the solute. Right. Pause. Right. In the liquid dosage forms, monophasic. Monophasic nothing what ma? Single phase. Okay. We'll call example is solutions. The dosage form is solutions. In nothing what? Syrup. Syrup is nothing but what? Adding of sucrose plus water, okay, with the concentration. They'll get like syrup. Then elixirs, then tinctures. Okay, so these are solutions. Whereas biphasic, two phases. The examples are emulsions. What are biphasic dosage forms? Emulsions and suspensions. Okay, whereas external solutions are apply. These are internal. Okay, these are external solutions are going to apply on the skin. Okay, that is lotions, liniments, and collodions. Okay, this is about what ma liquid dosage forms. Whereas coming to the gaseous dosage forms, they again these are divided into two types. One is medical gases. One is medical gases, and another one is what ma aero dispersions. Aero dispersions. Okay, this is aero. Okay, AERO. Okay, so where are medical gases? What? Medical gases are aerosols. Aerosols are nothing but what ma? Pressured gas dosage forms. Aerosols are pressured gas dosage forms. In aerosols, they having what ma? Inhalants and also volatile anesthesias, anesthetics. And whereas aero dispersions, they are anti-asthmatic sprays. Anti-asthmatic sprays. Okay. So these all are what? About the clearly about dosage form, route of administration and physical form, right? So thank you. Next class, I'll tell you about what ma. I already told you about the route of administration and physical form. Next class, I'll explain about the classification of dosage form with what definitions. Okay. Thank you.